Good evening, mothers. It's wonderful joining you today evening for a wonderful discussion on breastfeeding and the importance of breast milk. Dr. Arasar Seeralar, a pediatrician and a neonatologist with more than 35 years of experience. And I've been working in institutes in Tamil Nadu, bigger institutes which have been catering to 11,000 to 18,000 deliveries a month and a year. And that's my experience of interacting with mothers and seeing all mothers and babies and knowing how these mothers have become successfully breastfeeding their babies and what are the problems that mothers been facing in breastfeeding and how to solve these problems. So we are going to discuss today the importance of breastfeeding and when to start and how to go about starting and giving breastfeeds. Now, the first and foremost point I want to emphasize is that mother must start breastfeeding a child soon after birth. When I say soon after birth, what does that mean? Which means normally we put a time frame of probably within half an hour in a normal delivery or probably within 2 hours in a cesarean section. The basic principle is before the baby goes to sleep after birth, because after birth baby is tired of the process of labor, and like the mother the baby is also tired and it may go off to sleep. We call this birth recovery period, and during the next 6 to 8 hours it may not wake up to feed, and this leads to a lot of problems. And so what we tell mothers is to initiate breastfeeding within the first half an hour to 1 hour of birth. So what is the advantage of this starting this feed? The baby is awake. The oxytocin response is very, very good. So the moment the baby is put to breast, because the moment the baby is born, it feels so insecure and cries vigorously. At this time, to console this baby, if you are putting the baby to breast and making it to suck, it gets a sense of both the bonding and security and stops crying, as well as learns. Its first learning experience becomes when it sucks at the breast, it gets the milk. That security gets imprinted in its mind, and it knows that every time it is hunger, that the mother is close by and it can feed well. So this should not be forgotten. And if the baby after this period goes to sleep, we need not worry, because the baby now has fed and there is no risk of baby going for low sugar levels. And the baby, normal babies can tolerate fasting up to a longer time of 6 to 18 hours also. And so mothers need not worry about this feeding. And after some time, the baby wakes up and it knows now after waking up, now when it cries, if it is put to breast, it will start feeding very well, because it has already learned this first learning experience that if it sucks as the breast, it gets the milk. So this initiation of breastfeeding, we call, all mothers must insist their obstetrician and their pediatrician or the caretakers who are there in the labor ward to give the baby to them to start feeding within this golden time of half an hour to 1 hour, that is we call soon after birth. And there should not be any delay in this. Sometimes in cesarean delivered mothers, it takes some time for them to roll them out of the theaters, operative theaters, but we have been very successful in many a times putting babies to breast even within the operation theater also. And soon after the mother is wheeled out from the operation theater, even before she gains her consciousness, many a times we have done this, because that establishes a successful. Have a fear whether the baby's digestive system is so ready so early in life for taking these feeds and digesting these feeds. It's a nature's wonders that the baby soon after birth is capable of sucking and feeding well and also digesting the milk. You must know the milk that is created is the research work of wonderfully by nature over millions of years. So nature has put millions of years of research into this and slowly evolved this human milk for humans, and it is so specific to the human babies that one should be very clear that human milk is specific for human baby, and that is the best milk that the baby should get after birth. And any other milk other than breast milk is not the best milk. They are all evolved with a few years of research. But what breast milk is evolved over millions years of research. It's one of the complete plant food. So easy to digest by the baby. That's how God has designed and nature has designed that this baby's milk is so specific for humans. Why I say specific for humans? Why I'm emphasizing that? The constituents of the milk, we normally tend to talk on the cursory that it contains adequate proteins, fat, and there are so many other things that also equal to breast milk contains adequate protein, fat, all that. But you must understand the composition, intricate composition of the human milk. If you take the protein composition, though it may be equaling some other formula, but this protein composition, the amino acid composition, so specific for human beings' growth, especially brain growth, and especially for the entire growth and development of the baby. So it is species specific. That's why we say that human milk is specific for humans, and that should be the only milk that the baby is taking, especially in the first 6 months of life. And no other alternative should be thought of. The baby should be normally not fed any pre-lacteal feeds before the baby is given breastfeeds. And for the first, giving a pre-lacteal feed causes a lot of harm to the baby. Now, many times we have seen that due to traditional beliefs or traditional practices, sometimes because of the circumstances, wrong ideas, sometimes babies are given pre-lacteal feeds like honey, sugar water, and whatever. It is varying in various customary places. And I think these are all harmful for babies, and one should not give this. And the milk that the baby gets in the first few days should be the mother's milk. That is the colostrum. So colostrum is one important milk that plays a very important role in the survival and health of the baby, because colostrum is endowed and rich in all the antibodies, all the immune cellular elements, and it contains the laxatives that is very essential for passing the meconium and for passing of the stools so smoothly without much hardships to the baby. And the nutritive value is so well suited for the first few days when so much of transition is taking place in the baby from life in the womb to life in the outside. We call transition, fetal to neonatal transition. This transition period, if it is smooth, then things go on very well, and the baby tends to grow and develop very well, and the mother will be successful in making the baby breastfeed and make the baby grow healthier. And sometimes the question is asked, how often to breastfeed? The moment you have started the breastfeeding soon after birth, the next feeding may be sometimes delayed, but we need not worry. I told you, normal babies are capable of withstanding starvation for quite some time. So the babies go for a birth recovery period and sleeps for 6 hours. Mothers may also feel tired and sleep. And then when the baby wakes up and start crying for feed, that's the time to put the baby to breastfeeds again. So it should be a demand feed. When the baby demands, when he becomes hungry and demands feeding, then the mother must feed. Now, it should not be a scheduled feeding. Scheduled feeding is a practice for very low birth weight babies that are taken care of in the nursery. So, normally the advice many a times is feed every 2 to 3 hours. That's not the dictum. Don't feed every 2-3 hours. The basic principle is feed when the baby is hungry and the baby cries for feed. Though the baby makes some hunger cues, we call, that mothers must understand to know that now the baby is crying for feeding and it is hunger, like making some rooting reflexes by turning towards the mother, crying and putting its hand into the mouth and rubbing it. And these are some of the cues you will see that denotes that the baby is hunger and that the mother may start feeding. And the mother could simply start giving her breast milk, and the moment the baby sucks, the milk starts ejecting and the baby starts getting adequate milk. And clues to understand whether the baby is feeding well. Many mothers want to know whether the baby is feeding well. How to know whether the baby is fed enough also. So here what we say, how to understand whether the baby has fed well. So the capability of the babies are different. Some babies are quite vigorous and tend to feed only for 5 to 10 minutes and then become satisfied. It has taken its stomach full and just goes off to doze off to sleep. So babies normally, if they have taken adequate feed, just doze off to sleep at the end of the feeding. So that itself is a clue that the baby has fed enough. The other clues that the mothers can get to know whether baby is feeding well is the baby starts passing as many times urine as it takes feeds. That is 6 to 8 times urine and sometimes more also, and also starts passing stools 5 to 8 times in a day. But in the first few days, the first 1, 2 and 3rd day, the babies may pass a little bit lesser amount of urine and a lesser amount of stools. That's normal because the mother milk secreted in the first few days is a lesser quantity. That's a nature's design. The mothers should not be worried in the first 3 days that the milk secretion is low, because that's a nature's design so that the water content in the body of the baby gets redistributed for the transition of the physiology to happen in the baby for fetal to neonatal life. So that is why nature has designed that the mother secretes little milk only on the 3 days, but that milk is the colostrum is endo or energy packed and nutrient packed, and that is enough for the baby. And so one mothers need not worry that she is having very little milk in the first 3 days, and we should not attempt to give more feeds to the baby also in the first 3 days, because that will interfere with the transition of the physiology in the baby's body. So first 3 days baby gets the colostrum, little milk, that's enough. That's nutritively enough for the baby. You need not supplement any other than any other food or feed for the baby in the first few days. Then the other clues is your periodic health checkups when you are taking your baby to the doctor, or as long as you're in the hospital, the baby is weighed every day. We must know that the first few days baby tend to lose weight. That is physiological and it should happen. The weight loss in the first few days is very, very important, and you must allow it to happen. After 5th day, the baby starts putting on weight, gaining weight, regains birth weight by 7th day, and then on starts growing. By this time, from colostrum, mother starts secreting mature milk, and this mature milk makes the baby start growing, and the baby tends to put on roughly around 30 grams per day every day per kilogram body weight. And so that's how babies grow, and normally the first few months they may grow up to 750 to 1 gram, but the growth velocity slowly comes down as the baby is growing. It may not put on the same weight as you saw in the first few months. After the first few months, the baby's weight gain every month slows down. That's physiology. So this should happen. And by 5 to 6 months, the baby should have become double the birth weight. And by 1 year of age, it should have become 3 times birth weight. So that's how we know that the baby is been feeding well. If it's been gaining 30 grams per day, if it is been doubling its birth weight in the 5 to 6 months, it's been growing roughly around 750 to 1 kg in the first few months. These are all clues to know that the baby is growing well, and simultaneously development also starts. And in feeding, mother must be careful in their proper holding of the baby and attaching the baby, because if they are not feeding in the proper position and proper attachment, a lot of problems come to the baby and mother. one of the things that comes to the baby is the air swallowing that may happen with feeding, and this leads to a lot of problems of gaseousness, abdominal distension, and vomiting for the baby. And so, mothers must take care, learn the art of feeding the baby by proper positioning of the baby or holding the baby, then properly attaching the baby to the baby's areola, and then burping the baby after feeds. These are all so essential to see to that the baby doesn't spit much, doesn't swallow too much of air also. Now, many mothers have also fear about their diets, whether their diets interfere with the secretion of the milk, whether their diets interferes with the quality of their milk, whether the diet will do any harm to the baby, because every mother undergoes a lot of restriction during pregnancy. And if this restriction is continued after pregnancy also, mothers feels really boring. No, they feel sad that this restriction. Now we need to know whether these restrictions are really essential or not. What we would say scientifically, there is no restriction on the mother's diet. Mothers can take whatever they want, whichever suits them. That's the most important thing, whichever suits them. The mother who is used to taking a regular diet must start taking this regular diet, and they need not have any unnecessary restriction on fruits, vegetables, vegetarian or non-vegetarian things. Everything the mother has been tolerating before deliveries, all these foods the mother can start taking during lactation period also, and no harm will be done to the baby. Their milk quality will not be affected. But taking a healthy diet, mother is very, very important, because the more healthy diet she takes, with she must also take a balanced, nutritious diet. She must be taking at least additionally 500 grams, because this 500 calories she must be taking every day, because this 500 calories is very, very important. That's the energy expenditure for producing milk every day for the mother. So the mother must be taking little more of calories and protein, balanced, nutritious and varied diet, so that the breast milk is also endowed with all the nutrients that it should contain, like vitamins and minerals. That will help the baby grow better. And it is not essential to give the baby any additional supplementation, because the breast milk is the most balanced, nutritious, completely plant food for the baby, and it does not need any supplementation for the normal growth of the baby. But occasionally, sometimes at instances, sometimes drops are prescribed, like vitamin drops, especially vitamin D drops, because now we have become more indoors, and we are exposed to sunlight has become very, very limited, both to the mother and baby. So when mother's exposure to sunlight has become reduced, naturally vitamin D is also reducing. So that will have a little bit of lesser vitamin D in the breast milk. So nowadays, vitamin D is the only vitamin that is supplemented along with breast milk for babies, and no other supplementation, no other adequate feeds should be given to babies. And I think there is a question on why breast milk should be given up to 6 months. And because one of the mother did ask me, it was before 4 months time, and after that we were starting weaning, and now why it is being made to 6 months. So there is a scientific reason behind why breast milk feeding should be breastfeeding. Exclusively, first saw initiation of breastfeeding that should be started within half an hour to 1 hour, that is soon after birth. And now we look into one other important aspect, that is exclusive breastfeeding, that is feeding the baby only breast milk for the first 6 months of life. So everyone mind gets a doubt whether breast milk is sufficient for the baby for the 6 months. Second, why the concept has changed this decade from 4 months to 6 months. Now, as the understanding, scientific understanding has improved, as a lot of cohort of babies have been studied from mothers who have been started weaning diet very early, and how it is how these babies are growing, and babies whose weaning diet has been started after 6 months, how they are doing. So when this analysis was done, cohort analysis, they found starting weaning earlier to 6 months was not adding any benefit to the baby, but it was adding a lot of disadvantages to the baby. They found babies who have started weaning earlier were at increased risk of developing diarrheal illnesses and respiratory disorders. Now, did addition of additional food after 4 months give it any advantage? No. Was there increased weight gain? No. They were gaining same weight as babies who have been exclusively breastfed for 6 months. So, the scientific community had come to a conclusion that 6 months is the optimum time to give exclusive breastfeeding. Beyond 6 months, the time when you can start adding, along with breast milk, other supplementary diets to baby, and slowly train the baby to take slowly homemade foods so that the baby grows healthier. So from 4 months now, the exclusive breastfeeding is to 6 months. So up to 6 months, you must breastfeed your child. Only feeding should be breast milk, and no other feeding diet should be started for the baby. And this 6 months, many mothers actually come and complain that babies are demanding more feeds by 4 months. And the mothers also start feeling that the milk secretion has come down after 4 months. See, there are certain physiology that you must understand, nature's physiology. I'll put it into 2 or 3 aspects. Normally, mother secretes more milk than what the baby needs in the first few months. So, mother has her breast engorgement, she has got more milk. She many times ends up expressing a milk and discarding that milk at home. And slowly, this milk secretion, what it happens, slowly it gets slowly reduced. We don't call it reduced, we call it regularized, so that the milk secretion happens as much as the baby wants. So the demand becomes streamlined to the supply. So the supply becomes streamlined to the demand. So the mother starts feeling that she's started secreting lesser amount of milk, but actually she's not secreting lesser. Slowly as secretions are become regularized, so that only as much as it is enough for the baby is being now secreted. So this wrong clue should not be taken, she is secreting lesser. 3, a baby which has been now soon after feeding, going off, dozing off to sleep by 4th month, what happens? Soon after feeds, it may not go off to sleep. It now wants to play. So it wants to be carried, and then it wants to look around and enjoy everything. So it has been lying down for 3 months, looking at only that one single. So it cries, and that's a clue by the baby to the mother that it wants to be carried around. So when mother starts carrying the baby around, it stops crying. The moment she puts it again to the cradle, it starts crying. So this is misunderstood by many of the mothers, that the baby is still hungry and its tummy is not full. And so what they do is try to give it a little more milk and tend to please the baby and fill up the baby's tummy with more feeds. The baby goes out to sleep. And take this wrong clue, because anyone who takes more food than what is needed feels sleepy and go off to sleep. This is what happens. So you are disturbing a baby's physiology of learning. So when the babies are awake, it is looking around and observing and learning. So observation is the main way of learning for babies in the first few months. So mother should not interfere with the baby's observation. So allow the baby to observe everything in the environment. Let it learn. Don't put it back to sleep. So the clues that the mother's breast is not filling up as much as it is happening before. The clue that the baby is not going to sleep. 2, the baby that has been gaining about 750 grams to 1 kg every month, by 4th month drops to about 600 to 700 grams every month. So the mother thinks that the baby is not gaining adequate weight. Actually, it's a physiology. I told you the acceleration of the growth slowly decelerates. So the growth velocity is on the deceleration side. So if you take how the baby grows, the graph is not like that steep. So it is slowly sliding and then going off to a plateau by 1 year. So you should understand this physiology, that the baby's weight gain per day or per month slowly drops every month if the baby is feeding and growing well. And this should not be taken up as an indicator that the baby is not gaining adequate weight. You must only consult a doctor, see whether the baby has gained weight for that particular month. And these wrong clues in previous days and had made many a think that that they must start weaning by 4 months. Now the scientific community understood that 4th month is not the right time, and the weaning food should be started only beyond 6 months. So 6 months, up to 6 months is the time you compulsorily give your baby only breastfeeding. That's called exclusive breastfeeding. Now there are these days in our community that now mothers have become important part of the working group, and many of the mothers have been going to work. I have had many of the queries from mothers that they have been compelled to go to work because of social reasons, because of financial reasons, because of their work security, that they are forced to go to work very early. We know in a government sector, mothers are all given 9 months maternity paid leave, and this luxury is not enjoyed by mothers in the unorganized sector and private sector. So these mothers will be compelled to go to work. But I would suggest all mothers kindly at least exclusively breastfeed your baby for 6 months. That is because you are adding more life to your baby and more health to your baby. This first 6 months exclusive breastfeeding. Now, if there is a reason that you have to go to work very early, I would still suggest continue breastfeeding. And how to do that is to express the milk and then store it at room temperature. If your work schedule is only for 6 hours, you can express the milk, keep it in a clean, sterile container, and then feed this express milk with a spoon or any other small palade we call utensils. We discourage bottle feeding and nipple, because bottle feeding and nipple feeding with nipple introduce a lot of confusion in the baby, and also increases the risk of minute aspirations and risk of diarrheal disorders and wheezing and allergic disorders also. So bottle and nipple, though looks convenient, has a lot of harm to the baby. So I would say discourage bottle feeding and bottle with nipple feeding. The best thing is to, if there is a reason to feed them earlier, and this express breast milk, the mothers can do manual expression of breast milk. They can learn it from the lactation counselor or from the caretakers. There are breast pumps, nice breast pumps available that aid in the expression of the breast milk, then storing it and giving to the babies. If you are going to store it for a longer time, for 1 day, then you can store it in the refrigerator, regular refrigerator. If you are wanting to store it for too long a time, you can freeze it and re-thaw it and then use this milk. So that's very important that mothers learn to express breast milk, because many times small situations comes when they have to leave the baby for some time to their caretakers and go. During this time, the caretakers can take care of the baby. Now, some mothers say that the milk smells slightly different, but what happens when fresh milk always smells different from the frozen milk? Because some of the cellular elements do undergo some amount of minimal denaturation in that, and we are also freezing it and then thawing it. This freezing and thawing the milk introduces certain amount of small changes, because we need to rewarm the milk before feeding the baby. Bring it to around the normal temperature, room temperature, and before feeding to the baby. This is not unusual, and one mothers need not worry about this because babies don't refuse taking this milk, because the best thing that the babies can get, because I have told you from beginning, it's the most nutritively valuable, priceless thing. Understand? Because the composition is such that it's well suited for not only physical growth of the baby, but of the mental growth, better IQ of the baby, better longevity. Every aspect of human life is taken care of breast milk. So individual mothers will not have an opportunity to freeze their milk in that. Frozen milk, how it is done in breast milk bank, because breast milk bank in our hospitals where a lot of mothers donate their milk is utilized for feeding preterm babies. So a lot of milk is donated, a lot of milk is, these milk are all screened. Actually, the mothers who donate milk are screened, then the milk is screened, then it is pasteurized, then again screened, then it is frozen. So these milk do not undergo spoiling, and so this spoiling doesn't happen with milk that has been pasteurized and stored and given. And but in an individual house, in individual mother will not have situations to freeze the milk. So they probably can that day's milk that they can feed the baby, because mothers continue to secrete more and more milk. The more and more expression, the more and more milk the mothers secrete. Now, one more question has come. My baby sleeps off after sucking only for 2 minutes. What I need to do? Now, normally, how long will a baby breastfeed for taking enough milk? How to know that? Because the capabilities of babies are different. Now, normally babies who are put to breastfeed with a schedule where the mother follows demand feeding, normally there babies tend to feed longer because it is hungry and feeds longer. But babies who are on scheduled feeding, whom the baby you are putting to breast for feeding, it's not actually hungry yet. So when a baby that is not hungry you are putting to breast, it may take only for a few minutes because it gets satisfied or satiated by that and then goes off to sleep. But there's also other differences. The baby may lose interest because some of the babies lose interest in feeding that time, want to sleep, and you allow them to sleep. But the next time it may start feeding for longer time. So it is not compulsory that it follows a specific time frame every time it feeds. Sometimes it may be 2 minutes, sometimes it may be a little longer. So these variations are all normal, and we need not wake up the baby and again wake up the baby and feed. Only this repeated waking up and scheduled feeding is only for very premature babies who become tired of sucking. There they may go off to sleep because of exhaustion. There we need to, after putting them to breast for 2 minutes, then they are supplemented with express breast milk. So this babies who are feeding for 2 minutes, maybe you must also know whether they are sicker, because a baby that has been feeding every day 15-20 minutes suddenly stops not taking feed, weaker baby not feeding well. So that's a clue, that earlier clue that babies probably is getting some illness. So you need to watch. But if the next feed is taking normally, then be assured that the baby is doing fine. Now, what causes, one of the questions that comes is what causes gaseousness and colic. There are several reasons for gaseousness, but one of the main important thing is improper positioning and attachment of the baby to the breast. Now, when the baby is not attached properly to the breast, now probably in the next thing we will probably tell you what all to verify when you are making your baby latch to your breast, how to position your baby, all that. But when the babies are not latched well, they tend to swallow a lot of air. So when they swallow a lot of air, they tend to take lesser milk because their stomach gets distended more with air rather than with milk, and they get satiated and leave the breast early, so they are not taking adequate, so they cry more frequently for feeding. Because this gas, the air that is swallowed, what happens, it tries to come out, and it brings along with it the milk also, and it may cause too much distension of the stomach and gets colicky pain. So proper attachment, improper attachment is one of the reasons. Improper attachment and air swallowing is one of the important reasons for gaseousness, and also too much feeding. Every gut has got a capacity as to how much to feed. Some babies are force feed in schedule feeding because the mothers make the baby feed every 2 hours. Force every cry, the baby is consoled by feeding, so the baby tends to take more than what it needs. So what happens when more feeding is taken? Small amount of milk is not digested in the gut. That milk undergoes fermentation. This fermentation produces a lot of gas, and it produces explosive stools in the babies. It produces increased borborygmy, we call increased rumbling noise in the baby's gut, increased number of vomiting. The way to avoid this is proper attachment for the baby to breast. 2, not to overfeed the baby, but give them only demand feeding and not schedule feeding, and properly putting the baby for burping by putting it on the shoulders and gently facilitating by rubbing the back or tapping the back, or putting it in the lap in the supine prone posture, then gently allowing the stomach to get slightly compressed along the lap, and then that promotes the burping of the baby. That makes babies comfortable. And there is some more questions also. There is a mother who has asked how to improve their milk secretions. I think normally nature gives enough milk for their babies, but if any mothers feel that they are not having adequate milk, the reason could be multiple. It could be simply their mind state, it could be the diet, it could be their environment, it could be the baby that is not put to breast properly and made to attach properly, but maybe later to diet. But when you verify all of these things, whether if you have verified all of these factors and corrected all of these factors, that is her mind state, because the mother's mind is a very important thing. The more stressful the mind, lesser the hormone secretion, especially oxytocin and prolactin, that is very essential for the secretion of milk. If these two hormones decrease because of the stressful state of the mind, then these mothers will secrete less and they may end up with lactation failure. Actually, the nature has designed that mothers secrete enough milk, but there are interfering factors like this. So one needs to go into detail of all these factors, these stressful states, and then give the mother counseling to relieve her stressful states, regular help her in with getting a good balanced diet, enough adequate rest and sleep. That's also rest and sleep is also important for mother. So helping her get adequate rest and sleep, and also sometimes we could attempt to give many of the galactogogues. Some of them are available in the markets like Lactar and thing, but many times homemade diet preparations, that is the tradition, niche tradition. I think there's no harm. We should not keep them on any restrictions, but you can give them foods that has been traditionally thought to improve milk secretion, because anything taken with belief definitely works, and there are several beliefs in several communities, and if not harmful, it can be allowed to practice. And there is varied amount of foods that I have seen. It's not one single food that improves milk secretion. I think any food that makes the mother happy improves her milk secretions. Now there is one more question that has been asked by the babies having lactose intolerance, having symptoms of vomiting and once or thrice excessively vomiting, and lactose intolerance. I told you, normally babies have the capacity to digest lactose. Lactose is one of the main carbohydrate fraction of the milk, and it's so very important for both the body physical growth and the growth of the brain. And so we should not deprive baby of lactose, and that's what that gives the sweetness to the milk also. But if a baby lactose intolerance, primary lactose intolerance, we call it, the enzyme defect is that's very, very rare. 1 in a million cases of lactose intolerance we have seen. And so we tend to identify those babies by failure to try, not gaining weight. But normally babies who are taking more feeds also have a secondary lactose intolerance. That's called overfeeding lactose intolerance, where if they are fed too much, the lactose load becomes too much than what the babies can digest, and they undergo this undigested lactose, undergo fermentation and produce a lot of vomiting in these babies, and frequent loose stools also. And these babies tend to develop excoriations or perianal soreness also, but they don't lose weight. They continue to grow. So one of the clues that this is not very harmful is that though there is perianal soreness, there is a lot of bloating of the stomach, but in vomiting, it doesn't harm the baby, and this need not be the reason to stopping or changing the milk to lactose-free formulas. No, lactose is very important. The baby needs it for growth, the baby needs it for brain growth, and the baby needs it for energy, and it's the best carbohydrate, and it's a sweetness that makes the baby take more feeds also. So must be very careful. So rarely a disease process may come, and those instances a senior doctor would decide when to probably do that very meticulously. Now, how do I know whether I'm overfeeding the baby? This overfeeding the baby happens many a times when they are following scheduled feeding, because someone has told them feed your baby 2 to 3 hours. Now, a well baby that is born naturally, that is weighing normally should be fed only demand. But when it is fed every 2 to 3 hours, or fed every time it cries, it tends to overfeed. So how to know that it is being overfed? Because the baby starts gaining more weight than what it should gain. Apart from vomiting and frequent stool that the baby goes, it tends to gain more weight. Because it gains more weight, it undergoes a phenomenon called writhing. It continuously keeps wriggling its body as if it is suffering from gaseous distension. These are all indicators that the baby is being overfeeding, and the weight gain pattern also will tell us whether the baby is feeding being more, and the weight gain pattern, the number of times it voids urine will also, from normal, it may go up to 20 times or 25 times, like that. So overfeeding is also not good for babies. So babies should be fed enough, adequately. And feeding babies every time it cries is also not correct. Feeding babies only when it is hungry, and then crying out of hunger. So please understand the hunger cues, and then start feeding your baby. When at other times baby is crying, try to understand why it is crying. It may be just for the reason for lifting and playing with it. It may be the reason for just going out and looking around. It may be some unusual noise in the surroundings that has introduced some threat or fretfulness in the baby. So just console the baby, not by feeding every time, but by other means appropriately for the situations.